Now, the first point here is that overdose deaths in California are driven by fentanyl, but also stimulants, and this is very important to understanding the nature of the sort of evolving crisis. Here you can see on the y-axis the number of overdose deaths each year in California. Year is shown on the x-axis. One thing that jumps out is, of course, that overdose deaths in California have virtually tripled in the past 10 years, and to over 11,000 in the most recent year of data that is complete. The color of each section of the bar shows you which substances were involved in each death, and we can see that by 2021, actually the most common category of overdose death involved both fentanyl and a stimulant, mostly methamphetamine and also cocaine, at 33%. An additional 29% involved stimulants with no fentanyl, 23% involved fentanyl without stimulants, and only 15% did not involve one of these two drug categories. So fentanyl is very important, but we also have to talk about stimulants and their co-use together. The second key point that I want to make here is that over the past 5 years, overdose rates have increased fastest in California of any state in the country. Here on the x-axis, you can see the percent change over the most recent 5 years of finalized data that we have from 2017 to 2021. You can see that in California, overdose deaths increased by 130%, meaning they more than doubled in this period, and we are unfortunately the national leader on this issue. And you can see that unfortunately there have been increases in almost every state in the country. And it's also important to note that California had more overdoses in 2021 than any other state. Of course, we also have a very large population, but if there's one place to intervene on the overdose crisis in the US, it's California, right? If you had to pick one. And this kind of reflects California. For a long time, we had stable, low overdose trends far below the national average, and unfortunately, we have completely lost our advantage at this point and caught up to the national average. It's also important, the third point here is that Black and Indigenous Californians are the most affected by drug overdose now, and I think we have to view the overdose crisis as a racial justice issue. Here on the y-axis, you can see the death rate per 100,000 individuals from all types of overdose. On the x-axis, again, is year. And there is one line here for the overdose rate among Native Americans in blue, among Black non-Hispanic individuals in purple, among white non-Hispanic individuals in red, Hispanic or Latinx individuals in green, and then Asian non-Hispanic individuals in yellow. And you can see that really for the past couple of years, we've seen marked racial and ethnic inequalities in overdose. And by 2021, the Black overdose death rate was 44% higher than the white overdose death rate, and the death rate among Native Americans was 51% higher than white individuals. I think, over the past decade, we've seen a lot of press coverage talking about the sort of white problem of addiction and overdose, and in California, that's never been true. I think that narrative has been kind of flawed for the duration of the time that it's existed, but really now we must consider these kind of sharp and continually rising racial inequalities in this key health issue. And the last point that I'll make is that counterfeit pills are really a key vector for risk in California, and they're driving new risk among subpopulations not previously very vulnerable, such as teens in California. So this is a recent headline from an LA Times piece that says 7th LA Unified School District student teen overdose from possible fentanyl-laced pills. Here's a graphic showing some counterfeit and authentic oxycodone sold on the black market. And the point that I hope to make with this figure is that there is no way to tell the difference between the authentic and counterfeit pills just by looking at them. Our team was able to use sophisticated drug checking technology to tell the difference. We found fake pills containing fentanyl, containing heroin, and containing all kinds of other novel synthetic drugs. But, you know, a teenager could never tell the difference just by looking at these things. And this is a new threat. And our team actually was able to publish an article last year showing that for the first time in history, the high school age teen overdose death rate is spiking after decades of flat trends where teens were kind of insulated from overdose death rates going up among adults. And for the first time over the past 2 years, this issue is really affecting teens, especially in our state in California. We showed that teens on the West Coast were disproportionately affected, as well as Native and Hispanic and Latinx teens. And this is entirely coming from illicit fentanyls. Here you can access all of the articles referenced during this talk.